Everybody, this is Jason with drdcbd.com. I'm here with Dr. D, Don Davidson, MD himself. What's up, Dr. D?
Jason, happy Monday. We had a great podcast already tonight, and we're back for more.
Yep. So today is coronavirus CBD cure, true or false? So, Dr. D, what are your thoughts on the coronavirus and CBD, to prevent getting coronavirus, or what if you already have coronavirus? Is there any possibility, is there any way that CBD could help somebody?
Right. So this is a great topic, right, which gets blown up into different CBD companies that are irresponsible, making crazy claims of CBD helping this or that or whatnot, right? So I think some of the really neat things, Jason, to highlight about one, coronavirus, is that it is going to have a huge impact on the United States and world, in my opinion, right? I think that you will see more closures as this spreads at the community level in the United States. So I think that everyone should be aware of what's going on. We had a lady over here at our house today, actually, that hardly even knew that it was in the United States. So, definitely make sure you and your friends know what's going on. Make sure that you wash your hands, right, for 20 seconds or more after you come back from doing anything, or as many times as you can during the day. And as far as CBD goes, I think it's interesting to talk about a lot of the symptoms of CBD or of influenza or of the flu that CBD may help, right? So it's not going to be a cure for something like coronavirus, but there are folks that are going to become nauseous and vomit and experience inflammation with coronavirus that CBD may be able to help with some of their symptomatology. Now, another really interesting thing that I want to go through, Jason, are some research papers that really deal with the research going on and how CBD may be able to help in certain almost ICU type illnesses that are inflammatory, right? So things like acute respiratory distress syndrome, where you're having massive inflammation in your lung. And what sort of, interesting research is being done on a situation like that? Because that is how a lot of folks that suffer from a severe case of a virus are having such a hard time, right? Because that virus is causing inflammation in specific tissue types. And if it's your lungs and you get a massive level of inflammation in your lungs, it can cause basically a failure of that organ to function properly and exchange gas, right? So if we go over one of these research papers from 2015, you see in the Journal of Immunopharmacology and Immunotoxicology a paper titled "Cannabidiol Improves Lung Function and Inflammation in Mice Submitted to LPS-induced Acute Lung Injury." So this is an interesting early animal research paper where the conclusion says, "Thus we conclude that CBD administered therapeutically during an ongoing inflammatory process has a potent anti-inflammatory effect and also improves the lung function in mice submitted to this LPS or this inflammatory injury. Therefore, the present and previous data suggest that in the future, cannabidiol may become a useful therapeutic tool for the attenuation and treatment of inflammatory lung diseases." So that was in 2015, Jason. That's pretty powerful, right? So
Totally.
Is CBD going to make it into the hospital for use during acute inflammatory conditions such as viral sepsis or something like that? It may become part of the treatment armamentarium as future research, proceeds, right? So let's look at another paper, all right, from 2019.
And the links to these papers are in the description.
Yeah, and so this is why when people ask a lot of CBD companies, or CBD companies make crazy, outrageous health claims, Jason, why it's so frustrating to people like us, because there are these amazingly detailed research papers out there where CBD is being evaluated for really interesting conditions. So cannabidiol differentially regulates basal and LPS-induced inflammatory responses in macrophages, lung epithelial cells, and fibroblasts, right? So, you read the condition, the conclusion: CBD has a differential inflammatory response and acts as an anti-inflammatory agent in pro-inflammatory conditions. And now if we continue to follow that research further, remember that was 2015, 2019, and now we have 2020 March. There's a giant announcement, a PR newswire was released basically today, right? Today, a CBD company plans an acquisition of another company as their CBD product gains potential coronavirus treatment momentum. And what are they talking about? What is this research drug being studied for? Well, this CBD company confirmed efforts earlier today to evaluate its proprietary CBD extract formulation as a treatment for coronavirus symptoms. They have a CBD formulation that's being studied for symptoms associated with chronic obstructive pulmonary disease and other similar respiratory conditions. And that's a patent that they hold. And they've shown in their data that their CBD provides significant anti-inflammatory responses in vitro. And they state that the next phase of research is moving forward in the preclinical stage to expand evaluation of effects on the lung function, total body distribution, and some other things that aren't too exciting for you to hear about. But this is exciting, and this is what, Jason, is really neat as you follow this research through the last few years, seeing those early animal models that showed promise, all the way now to seeing a drug basically being put onto the market for an inflammatory chronic lung condition like COPD, and that also may hold promise in acute, inflammatory conditions in the lung, like part of what a virus like coronavirus can cause. So, this is like the really responsible way to present this data to people. I mean, go ahead and look at some of these links. You've got there here about research from 2015, 2019, 2020, and there may be some promise to using CBD in some of these conditions. And it's just really an interesting thing. And,
quick question.
Yeah, absolutely.
You often refer to a study about chronic levels of inflammation. Does that have anything to do with this or no? Yeah,
so I do think that there's an interesting study, which kind of goes back to a lot of what the Dr. D product line is all about, and that's full spectrum, because we see an increased, basically efficacy in studies when folks in research use a full spectrum product. The level of inflammation in a certain Israeli research study, when you use a full spectrum product as compared to an isolate, you see a linear, basically, decrease of inflammation in that animal model as a full spectrum product is increased in concentration. And when you use an isolate or a single molecule CBD product, THC free, you see a bell curve where you're increasing that isolate or CBD level, and you see a decrease in inflammation, but then it levels off and actually gets worse. So, as far as what people should try if they're looking for what we would say is the most therapeutic product, as far as the data goes now, full spectrum, all the way. And that means examining those lab tests, making sure that all those minor cannabinoids are in those products.
Sure. Can you show an example of one of our full spectrum products?
Yeah, absolutely right. So the full spectrum products that we have in stock right now, everyone, are the Dr. D Cinnamon 750 milligram full spectrum products. We also have the 1500 milligram full spectrum tincture. And so those are two great ways to start with the Dr. D CBD full spectrum line with a dropper full, morning and night, and see how that goes with our go low and go slow dosing approach, where you gradually increase the dosage of CBD over a few days or a week. We also have soft gels, which are easy. And if people are kind of achy and sore, we also have CBD lotions and topicals, right? Like this 4-ounce one, where folks can massage that into places on their body which are a little bit achy. And as we know, there is pretty neat data in animal models that CBD can interact with things like TRPV1 receptors in skin and seem to help with things like pain.
Hey, we have a comment.
Right on.
Wow, dude, this is reaching. Your claims are reaching amazing levels. All right. Good stuff.
Right on. Yeah, so another fun day here in Vegas, right?
Yeah. So where can people find out more information on Dr. D CBD?
Yeah, if anyone wants to find out more information on the product line, you can visit drdcbd.com and check out all the blog posts, the products, for sure.
Yeah, definitely. And just a reminder, this was for educational purposes only, not making any medical claims.
Yeah, absolutely, right? And you know, the nice part about all of this stuff too is there is a real need for products like this out there at a time like this. And with the ability to ship products and the ability for people to have questions answered over telemedicine without having to go in person to a doctor's clinic, that is really powerful. So, you know, this is a time where medicine and telemedicine and pharmacies that can ship products to patients, like some of these things that we are developing here at Dr. D, like the telemedicine for cannabis recommendations, like the new platform, Everyone's MD, that we are developing. These things are truly helpful, you know, in times like this where people need help. And
awesome. And guys, if you have any questions, comment below. And again, drdcbd.com. Look in the description for the links to the studies that Dr. D was talking about, and we will see you next time.
right on. See you later, guys.